The HSE is a research-active organisation and wants to benefit from the knowledge generated. There is consistent evidence of a gap between research findings and practice, and of a failure to translate research findings into policy-making and improvements in treatment and care. Overall, it's estimated that up to 85% of research is wasted. Why is research wasted? Often because it doesn't reach practice, policymakers, or the people who can benefit from it. Sometimes it's because the research isn't good quality, doesn't ask the right questions, doesn't use the right methods, or doesn't involve those who might be able to use it. And sometimes it's because research isn't published or shared with the public, making publications inaccessible or hard to understand. Bridging the research practice gap. As a researcher, you may have been working for months or possibly years to find out something new in your topic area, and you want your findings to be used and to make a difference. Knowledge translation, or simply KT, has emerged as an approach, specifically in healthcare, to address many of the challenges of putting research results to work and to start closing the gap between research findings and practice. What is knowledge translation? In the HSE, we define knowledge translation as finding, creating, sharing, and using research knowledge. It connects those who generate new knowledge with those who use or apply that knowledge. Effectively, knowledge translation is about building bridges between those who generate new knowledge and those who use or apply that knowledge. Knowledge translation activities also feed into HSE policy, guidance, education, and training. Will your research be used? Research matters. Good quality research can play a role in service development, improving services for service users, informing guidance or policy, and in education and training. It doesn't matter whether your research study is small and based within your service, or it's organization-wide, or even international. Sharing your findings and reaching the people who need to hear about and can benefit from your research is key. Sharing research findings makes a difference to our understanding of different conditions and treatments. What you have found in your study might also change guidance or policy or influence training. Begin with the end in mind. Knowledge translation is not something you do only at the end of your research study, but should be planned from the start. KT requires the involvement of all stakeholders. By finding out who your stakeholders are, engaging with them early, and asking the right questions, you are much more likely to influence how the findings from your study are used in policy and practice. KT can make a big difference. Impact. There is clear evidence that a strategy for undertaking knowledge translation and a plan for carrying it out can make a big difference to the outcomes and impact from research. Already, researchers across the health service are using knowledge translation approaches and tools to deliver better outcomes and impact from their research. Should you be doing the same? If you want your research study to make an impact, then you should be planning for KT. For more information and to access the R&D Knowledge Translation Guidance and Toolkits, go to https://hseresearch.ie. Sharing research findings and knowledge is the right thing to do.